Hi there, my name is David Nicholson. I'm a paramedic with the London Ambulance Service. I've worked with them for about 3 years now, and I've just finished a 12-hour early shift, as you can probably tell, as I'm quite tired. Um, and I was just been asked to talk about some of the jobs and call-outs that I've attended today, just to highlight some of the inappropriate calls that we attend and some of the calls that are appropriate and that do need ambulances. So, for example, we started our shift today at 6 a.m. and our first call out was to a lady in a gym who had fallen off a treadmill and grazed her elbow and her knee. This is sort of a good example of when 909 isn't really necessary. She didn't have any serious injuries. She could have self-cared at home, taken some paracetamol, looked after herself by other means instead of calling an ambulance. So that's sort of an example of an inappropriate call in which it that then ties up an ambulance for a considerable amount of time, in which time someone else who is much sicker, who needs an ambulance, may not get one because we are busy dealing with inappropriate calls. An example of this is my last patient today was a lady in cardiac arrest, which means that her heart had stopped and she wasn't breathing, and it's probably the most serious case that we attend as paramedics in the pre-hospital environment. It's very serious. It's very paramount that we get there quickly, get our interventions in place so that we can give this patient the best possible chance of surviving this devastating illness that they're currently going through. And if we're dealing with inappropriate calls, such as a lady with a graze, or someone who is intoxicated, or someone who could have gone to see their GP or a pharmacist or an urgent care centre instead of calling 999, it's quite bad that we won't be able to attend these very sick patients because we're busy, tied up with other patients who may not require an emergency ambulance. So the message we're sort of saying this year is to just think before you dial, use us wisely, and hopefully people who really need ambulances get them